Welcome to my channel, the Fit Hub I am telling about. The projection that CT scans could result in 100,000 new cancers in the U.S. is a result of the cumulative exposure to ionizing radiation that these scans involve. Here's why. Ionizing radiation. CT, computed tomography. Scans use X-rays to create detailed images of the inside of the body. X-rays are a form of ionizing radiation, which means they have enough energy to remove electrons from atoms, potentially damaging cells or DNA. This damage can increase the risk of cancer over time, especially if a person is exposed to high doses of radiation. Cumulative exposure. While a single CT scan exposes a person to a relatively small amount of radiation, many people in the U.S. are undergoing multiple scans over their lifetime. With the increasing use of medical imaging for diagnosis and monitoring, the cumulative dose of radiation can be significant, raising concerns about long-term health risks. Increased use of CT scans. Over the past few decades, the use of CT scans has risen dramatically due to improvements in technology, broader access to healthcare, and their effectiveness in diagnosing conditions quickly and non-invasively. As a result, more and more people are exposed to radiation from these scans. The risk. Studies have shown that the risk of developing cancer from a single CT scan is small, but it's not negligible. The risk increases with the number of scans a person has. According to estimates, 1 in 2,000 people exposed to a single abdominal CT scan may eventually develop cancer as a result. The numbers can add up when considering large populations and multiple scans over a lifetime. Vulnerable populations. Certain groups, such as children, are particularly sensitive to radiation. Children's cells are dividing more rapidly than adults, making them more susceptible to radiation damage. Additionally, people who have many CT scans for chronic conditions or repeated medical imaging may be at higher risk. Modeling the impact. The 100,000 figure is likely based on mathematical models that estimate the number of cancers that could develop in a population over time due to CT scan-related radiation exposure. These models consider factors like the current rate of CT scan usage, the radiation dose per scan, and the increased risk of cancer associated with this exposure. Balancing benefits and risks. While the radiation exposure from CT scans does pose a potential risk, they are still a crucial tool for diagnosing life-threatening conditions such as cancer, heart disease, and traumatic injuries. The medical community strives to balance the risks of radiation exposure with the potential life-saving benefits of these scans. In cases where a CT scan is necessary, the benefits generally outweigh the risks. However, unnecessary scans should be avoided, and the medical community is working on finding alternatives that minimize radiation exposure. What can be done? Minimizing exposure. Physicians are increasingly aware of the need to limit radiation exposure and will only order CT scans when the benefits clearly outweigh the risks. Lower dose scans. Advances in CT technology have allowed for the development of lower-dose CT scans, which use less radiation while still providing valuable diagnostic information. Alternative imaging methods. Non-ionizing imaging methods, such as MRI and ultrasound, are often used as alternatives when appropriate, as they do not involve radiation. In short, the projection of 100,000 new cancers is largely based on the cumulative effects of radiation from many CT scans over time, and it's a reminder of the need for careful management and consideration of the risks involved in medical imaging. PLZ, like and subscribe my channel. Thank you.